Good evening, Director and distinguished guests. My name is Melissa Turk, and I'm here to speak to you about an issue that has not yet been remedied for the great state of Louisiana, the incidence of preterm birth. The preterm birth rate in this state is still greater than the national average, causing the March of Dimes to continue grading the state at an F. Now, why is this important, improving the grade from the March of Dimes? Preterm birth is the leading cause of infant mortality. Preterm birth causes serious lifelong consequences for both the mother and child. The child may experience anything from developmental delays to death. The mother and family are required to provide care above and beyond what most infants and children require. This can be anything from additional medical specialists to different schools and learning environments. The Institute of Medicine calculated the national cost of preterm births to be about $26 billion in 2005. And preterm birth is often preventable. Elimination of early elective cesarean sections decreases the rate of preterm birth. Access to and utilization of prenatal care is also a way women can decrease the risk of preterm birth. Mothers who smoke, drink, and use illicit substances are also at a higher risk to experience a preterm birth. Decreasing these habits will decrease the number of preterm births. However, there are some risk factors that cannot be changed that increase the risk associated with preterm birth. Low socioeconomic status and low education are risk factors for preterm. In 2016, more than half of the residents in Louisiana have no college education. 1/3 of the residents make less than $25,000 annually, and close to 60% of the state makes less than $50,000 annually. As of September, there is still 10.3% of the population uninsured in Louisiana. These individuals, because of out-of-pocket costs, will not seek preventive care like prenatal care. Additionally, free and low-cost clinics for prenatal care, like Planned Parenthood, are located in cities, which may prove inconvenient or inaccessible for rural mothers. While the general demographics may not be able to be altered, the factors that can be modified should be, like access to insurance and access to prenatal care. To sum up the problem concisely, Louisiana women of childbearing age with low levels of income and education are at greatest risk for preterm birth and its numerous consequences because lack of affordable health insurance and the lack of prenatal care obtained by pregnant mothers. When we look at the socio-ecological model for this issue, there are aspects that help and hinder the risk of preterm birth at each level. At the individual level, having self-worth and self-esteem, as well as a positive outlook on motherhood, all help reduce the risk. On the other hand, beliefs that preterm births happen no matter what care is obtained and negative views about motherhood all help increase the risk of preterm births. At the interpersonal level, having a support system like friends and family help reduce the risk, but then time constraints of physicians do not allow them to adequately assess the true level of understanding of their patients. Because of this, patients be more likely to not adhere to the advice of a physician, end up in a situation where a preventable preterm birth occurs. At the organizational level, Planned Parenthood, along with other low-cost or no-cost clinics, and the Louisiana Department of Health provide health care opportunities to reduce the risk. Additionally, the Louisiana Department of Health and hospitals integrated vital statistics with Medicaid data to effectively intervene medically with mothers who had already had a preterm baby and are pregnant. A problem that increases the risk of preterm births is that access to Planned Parenthood and other organizations is limited for mothers in rural areas. In all of Louisiana, there are 2 Planned Parenthoods, one in New Orleans and one in Baton Rouge, while other low-cost clinics are also focused in the cities. At the community level, the media attention and March of Dimes bringing to light the rate of preterm births in Louisiana helps bring awareness and gravity to the situation. The Louisiana Department of Health has health initiatives to provide assistance for women. The media attention to the situation also works against reducing the risk because it offers criticism but does not offer solutions or resources to help. At the policy level, the Affordable Care Act mandated that all Americans have health insurance, and the Medicaid expansion occurred and allowed for more people to qualify, which would reduce the risk of preterm birth because it would eliminate the financial access to health care. However, there are no laws mandating obtaining prenatal care or mandating affordable prenatal care. The argument against the Affordable Care Act is that it is not actually affordable for uninsured mothers who make too much money to be on Medicaid. Now the important part, how we fix this. how we can reduce the incidence of preterm births in Louisiana, knowing all the factors that work for and against us. These models would incorporate my role as health educator, stakeholders, community healthcare workers, and the community itself. The first evidence-based practice model is Healthy Babies Are Worth the Wait. This model allows us to demonstrate the hazards of preterm birth, the causes, how to prevent it, and the importance of prenatal care through media campaigns. It also allows us to utilize group prenatal care to provide adequate care for mothers and their babies, while allowing mothers to take control of their own care. Similar to the centering pregnancy model of group prenatal care, this model also utilizes group prenatal care to empower women to take control of their health. The group prenatal care promotes health independence and accountability. This model also allows for grouping women according to gestational age to give women access to their gestational peers. The last model focuses on mothers who have already experienced a preterm birth because those mothers are at higher risk of experiencing an additional preterm birth. This model, the Interconception Health Promotion Initiative, utilizes home visits by healthcare workers to incorporate care and support for the mother and baby. It aims to reduce risk associated with preterm birth and promoting healthy behaviors like smoking cessation, contraception, and accessing early prenatal care. This model would provide referrals and transportation to resources required for the well-being of the mother and child. There are a few ways I would evaluate the successes of these programs. The first would be that 60% of the women giving birth within the next 2 years report having been exposed to the media campaign on television, radio, or social media. I would also expect to increase the positive perception of accountability and responsibility for personal medical care in women by 50%. Another measure of success would be to see an increase in the use of medical and social services by mothers and children by 50%. Another goal would be to decrease the number of women smoking or using illicit drugs in interconception care by 50%. Lastly, I would like to increase use of contraception between pregnancies by 50%. All of these goals would ultimately lead to a decrease in preterm birth rates annually and increase women and children accessing preventive medical care. There are a few potential barriers to implementing these evidence-based practices. The first barrier is cultural values. If these programs and cultural values do not align, then implementing any plan to reduce the number of preterm births will be difficult. One way to address this issue is to gather data from the area locally about what is important to the community and what they value and believe. Another barrier is the negative mindset about healthcare. In some studies, women reported not accessing prenatal health care because they knew women who accessed care and still had complications. This may be addressed with getting patients involved in group prenatal care and interconception care so that these beliefs may be dissected with other mothers and professional healthcare workers to put their minds at ease. Finally, a major barrier to implementing these programs is adequate funding and resources. Reducing the risk of preterm births in the state of Louisiana is a long process, just in fact because gestation is 9 months long. Having stakeholders involved, grants, and any other sources of funding and resources is essential. It is my job as a health educator to secure stakeholders, but as the Department of Health of this state, I will also rely on your help to secure the necessary funding and resources to address this dire problem. Thank you.